Okay. Uh, Hello, everyone. Welcome to our Facebook page for our second event, virtual discussion on understanding COVID-19 response dynamics perspectives from Africa. We have three very distinguished speakers with us today. I would like to first introduce all of them. First of all, we have Dr. Chima Amadi. He's one of Nigeria's most highly regarded policy and political commentator. Dr. Amadi is an election expert in sub-Saharan Africa, and he regularly participates in a lot of TV debates. Um he's also the former executive director of the Center for Transparency Advocacy Nigeria. Our second speaker is Ms. Leah Marie Lucas, who is an intercultural development professional specializing in food security and rural economic livelihoods. She holds an MSc in African Development from the London School of Economics and Political Science and a BA in Poverty and Progress in the Americas from Grinnell College. She was a Fulbright Economic Development Research Scholar in Mozambique. Uh, as director of Caritas Pemba, Lukas led Caritas response to Cyclone Kenneth, partnering with diverse organizations including the UN World Food Programme, the Food and Agriculture Organization of the UN, UNICEF, USAID, International Organization for Migration, and Catholic Relief Services. Leah has previously worked in India, amongst other places, Uganda, Bolivia, Brazil, United States, United Kingdom, and she has led a social enterprise in Guatemala for 2.5 years. Our third speaker today is Ms. Hari Nirina Raku, who is a Research and Decision Analysis Officer. She is a native of the beautiful island of Madagascar, has a master's degree in economics and an MSc in management science from the London School of Economics and Political Science. Her career began with a few years as a consultant in strategy, organization, and economic studies, allowing her to intervene in various domains and interact with clients at all levels. Keen on keeping organizations to make better decisions, she launched her own decision analysis business. Among other contracts, she now works as research and analysis officer for an international advisory firm. So I welcome all of you to this virtual discussion. Um, I'm going to start, first of all, with Chima, because I think he received a lot of questions from a lot of different people. So, Chima, I would like the
Yes.
others to mute their mic for some time. Uh, Chima, one of the questions that we got for you was that in terms of awareness of the coronavirus in your country, the government is not doing it right. What is, according to you, would have been the most effective way for creating awareness about COVID-19 in your country?
Well, thank you very much, Bhaskar, and it's good to see my fellow LSC alumni and friends, Leah and Eric. It's good to see you again. Look, the truth is, I don't think there's anybody in the world that has not heard about the coronavirus. The virus is its own awareness, uh, you know.
I think
Um,
yeah.
So, in terms of people knowing what the disease is about, or if there's anything going on, everybody knows that something is not right with the world right now. However, the issues that I believe the questioner is trying to understand, we deal with. The issues that the questioner is trying to understand, we have to deal with if the government's interventions have gotten the necessary awareness, whether individuals are aware of what they're supposed to do in the event that they are exposed, or they know about anybody that is exposed, and then what are the measures that are in place to ensure that the most affected or the most vulnerable in the society are shielded from the effects of the virus. And this is where people are really worried about. So it's not about the issue of whether there is something going on. Even with the level of illiteracy in my country, which has been put at less than 40%, so the literacy level is over 60%. Everybody understands that there is something not right. If you don't know that there is a disease, the lockdowns has affected everybody. The fact that people are not able to access markets, I mean, you need to ask questions. And so, what could the government have done? There is a lot of distrust in many states around Nigeria. And the distrust has to do with some people believing that the whole coronavirus, quote unquote, noise is manipulated by the ruling elites to further continue to lay their hands on the collective patrimony. To put it very, very straight, there's a common belief amongst many of our country folk that coronavirus is another scam that is being used to siphon money, and you will not blame them. You will not blame them because of the way it has been handled. The government has not stepped up to the plate, and I'll give you certain examples. In one of the states where the virus is right now ravaging the residents, you have a situation where when it actually came into the state, many persons were daring the disease. Many persons were ignoring every hygienic policy that was put in place to prevent contact with individuals. In fact, they were actually exposing themselves to individuals. So you want to ask yourself why. And the reason is because there's a disconnect between the government and the people. There's a disconnect between policies and the people. And so when you have that disconnect, you tend to have mistrust. And then the government could have used persons that individuals, especially the not too educated class, on respect and people they listen to. In a country like us, where you have lots of divergences in terms of education, religion, culture, you need to play up these differences to educate the people. So in the place, for example, in the north, where people listen more to religious organizations and religious leaders, you need to have allowed them to be the ones to carry the message of the coronavirus, rather than allowing government agencies to carry the message, because nobody really trusts them, since they are seen as the problem and not the solution. Secondly, the government did not also tap into the non-state actors in terms of non-governmental organizations, faith-based organizations, community-based organizations, to help them in propagating the message of interventions, the message of prevention, and other message the narrative they wanted to spew. So they did it on their own, and as a result, people lost faith in them. And that is the reason why today you have an ascendancy in the figures in in Nigeria today. As we speak today, we have hit over 8,000, and projections is showing that this is going to continue that until the fall, let's say October.
Thank you, Chima. Now I would like to put across a question for Leah. Yeah, Leah, you have worked a lot in Mozambique, and recently it was also devastated by cyclones. So how do you think the COVID-19 virus has affected the
Basca,
human?
I've lost audio. I've lost your audio.
Okay. Chima, my next question is for Leah. So I'm going to put a question across to Leah now. I'm muting you for a minute, for some time. Leah, can you hear me?
Yes, I can hear you.
So Leah, I wanted to talk to you about the situation in Mozambique, where you have been working. The country was devastated by earthquakes and cyclones. What, according to you, is the humanitarian situation on the ground now in the country due to COVID-19? And what progress has been made since the Idai Kenneth, and what is still out there to achieve?
Audio lost.
So, much for your question. I'm going to respond to, the more specific area in where I worked, which is Cabo Delgado. So this is in the north most part of Mozambique. And in Cabo Delgado, there is this situation of overlapping humanitarian crises. On about 1 year ago was when Cyclone Kenneth came to our province and really had devastating impact on the local population. At this time, the population, they lost their source of livelihoods, they lost their homes, they were forced to relocate. But Cyclone Kenneth was not the first humanitarian to come to Cabo Delgado. There was a pre-existing insurgency that was, ongoing since in an increasingly manner since October 2017. So we have the situation in the north of Cabo Delgado right now, which is a situation of extreme human need, which is very desolate and really tragic. So if you can kind of overlap every crisis that we have in the situation, first there is a situation of extremely low levels of education, extreme high levels of poverty, extreme high levels of malnutrition, all sorts of communicable diseases. A cyclone comes on top of that to destroy livelihoods, to destroy houses, and to increase the number of displaced. The insurgency becomes a sort of full-out war, which is now, really turned into more of a war zone, the province where we live, and 19 as well in that same region. And the first case in Mozambique, which was detected, was actually in that same province of Cabo Delgado. It was at the site in the region of Palma. Since then, the number of cases have increased in Mozambique, and they're up to 134 cases right now. So you may not be, so shocked or so alarmed by that number, but in fact, those are tested, cases. We've seen a very high number of asymptomatic members of the population, and also very low testing capacity. In comparison to countries, Mozambique has a lower number if we compare them to Zambia or to South Africa, etc. Tanzania even is higher than Mozambique. However, the testing capacity of some of these other countries is a little bit higher. So if we look at the number of tests that are being done per 1 million people, such as Zimbabwe, they're currently doing 2,495 tests per 1 million, which is actually a really high testing capacity. Mozambique is doing 290 tests per 1 million. So recently there were migrants who went back to Zimbabwe from Mozambique, and a large number of them traveled from Mozambique, arrived in Zimbabwe, and then were found to be positive. So I'll end my comments here to not continue too far, but I would just say that the situation is extremely dire. It's extremely bleak. This all pre-COVID-19. The situation was said to have progressed from a situation of emergency around the time of Cyclone Kenneth to a situation of calamity due to insecurity and violence. So, I guess now we would have a double calamity with the impact of COVID-19, the economic impact, and also both direct and indirect health impacts. Thank you so much.
Thank you, Leah. I would like to now talk to our friend from Madagascar. So we've been hearing a lot. Harinirina?
Yes.
Yeah. So we have been hearing a lot about the herbal concoction in your country, COVID organics, in the news. So I just wanted a first-hand perspective from you about what it exactly is, because we have been reading about that it is used as a preventive measure. It's also being used to treat COVID-19 patients. So I just wanted to know from you about it, if you can give us some insights.
Yes, it's a very personal opinion, and I'd say I cannot say it's really first-hand, because we are like 25 million people in Madagascar, and only 758 confirmed officially cases. So I don't know anyone who has COVID-19 or who recovered from it. I just saw a testimonial from a national singer, which was showcased on the media and on TV and so on. And she claims that she recovered exclusively from the herbal concoction. And she was joined by other people who are less famous, but the figure is, to me, too meager to convince myself. So that's why I say it's just a very personal opinion. And as for the prevention, on the time the herbal concoction was launched, we had less than 200 cases officially, and now we have already more than 700. So I let you do the maths. Of course, the authorities say that there are other reasons to that raise of sudden rise of the numbers, but to me, it doesn't quite add up yet. So that is my very humble ground insight, personal ground insight. And if you ask other people in Madagascar, they might have very different opinion because, of course, they might have other information I don't have access to.
But is it true that Madagascar is also supplying this herbal concoction to other countries? And do you think there is some kind of a bias that WHO is having towards COVID organics because maybe it's coming from an African country?
Yes, our president made that bold move. It was on France 24, and he stressed that rarely there are doubts when it comes from a Western country, meaning when a European country or when the USA discover a remedy, the WHO rarely say there is a bias. So, to some extent, it's true that there might be bias because the traditional remedy is not tested the same way as as how to say a medical remedy.
Mhm.
And so today the WHO is waiting for more solid evidences. And it's also true that the concoction is provided to other African countries and for free. Yes, I think that's all I have to say. If this answers the question.
Thank you. Uh, Chima,
Yes, I can hear
yeah,
you.
Chima, you're also a very prolific businessman in your country. So one of the things we got from hello,
Yes, I think I can hear you better now.
can you hear me?
Yes, I can.
Yeah. So one of the questions that we got for you was, what are the industries? Can others mute? Others unmute. So what are the industries you think that will succeed in a post-COVID-19 world when we go from COVID to a new normal? What are the industries and sectors which will benefit? And
Okay. The reality is, I think, with what happens, many nations were exposed to the frailties of their economy. Uh, no nation was spared. Even the United States realized that it had to depend so much on China for basic medicals, PPEs, and all that. So the exposure of various economies now would reflect on the way the economies are organized going forward. In terms of, do you want the state to be more involved in directing where industries should focus more in, because we now know that a pandemic like this that we thought would never surface anymore after the last one in the last 100 years, it's possible, and the ramifications is something that world leaders, economic organizers will have to deal with. And the most affected beyond the small and medium scale enterprises and even large scale enterprises that were shut down. I think governments will have to focus more on strategic aligning of industries to meet their needs in terms of in cases like this. But when you talk about also who was worst hit, virtually every industry has taken a hit. The industries that perhaps have not have been affected much might be maybe the pharmaceutical industry that are trying to find a solution, and maybe the food industries. But then in Africa, Nigeria, for to be specific, the pharmaceutical industry depends on imports from other countries, from India, from China, and other countries. These countries virtually had to look inwards and stop exports because they needed also the drugs that they were exporting. So I think this time around, the government have to take a decision to begin to manufacture some of the basic items, basic drugs within the country. We also look at food imports because the global transportation network was affected. Food scarcity is setting. For those of us that Nigeria is more a consumerist society, most of the foreign foods that we are used to, it became scarce. So we now let's think about how do we begin to produce foods to serve the over 200 million Nigerians, and then, more importantly too, I think the government also wasted an opportunity to integrate the SMEs in their intervention programs. So on one hand, you lost revenue because of the fall in commodity prices and oil prices, but on the other hand, the SMEs are supposed to guarantee a rise in revenue in terms of taxes and all that. You couldn't have a palliative or an intervention that could streamline them, bring them into the mainstream, in terms of collection of taxes. So I think that if you talk about businesses or industries that will survive or that people should look at more, the same businesses, the same industries that have been in existence, but then this time around, every government, wherever they are, will need to think about how do you position or organize the economy such that when such things like this happen, that you will not have to depend on other countries for basic things like that. And that is the lesson that the Americans have learned in a very hard way. That is the lesson some countries in Europe have learned. And that is the lesson we are learning from Madagascar. The Madagascan government, they stepped up, did what they had to do. I mean, and today the world is celebrating that case from Africa. But unfortunately, we ourselves as Africans are not celebrating it, and we're beginning to questioning, a local attempt to find solution at something that affected everybody, and we're looking outside. These are some of the things that we need to talk more about as Africans.
Thank you, Chima. Uh, Now I would like to come back to Leah. So, Leah, I would like to ask a question from you. Yeah. I wanted to know, like, since you are working on the field in Africa, uh, in the time that we now, the times that we are living in, that we are seeing uh, what all catastrophe that COVID-19 can bring to the world, how important it is to strengthen health infrastructure and essential services, because this COVID-19 pandemic has exposed us all. How important do you think it is for us to act now?
So I think your question is regarding health systems, and I will speak from the experience that I have on the field in the field in Africa. I'm no longer there, but made a recent move just to be transparent. So, I think that when we think of health systems and the introduction of COVID-19 to this sort of very fragile health environment pre-existing in Mozambique, we're facing multiple crises again, and this is just in the health sector. So if you're considering a country like Mozambique, which has 2.2 million people who are living with HIV or AIDS, this is a large percentage, the large number of the population to be suffering from a comorbidity such as HIV, and there are many others as well, such as tuberculosis, leprosy, very high levels of malaria, surges of cholera, anemia, malnutrition, hypertension, diabetes, heart disease, etc. So, I mean, these are facts that we all know. But I think that when we're considering the health systems, one of the things that we've seen on the ground in Mozambique is that some of these illnesses are actually going to be suffering and perhaps increasing in number as the COVID-19 crisis continues. And this is because people are not accessing the medication that they were previously taking, for example, for HIV. They're not accessing their medication, perhaps because there's some limitations on travel, perhaps just because of this great fear to, as a vulnerable member of the population, to catch COVID-19 or to be exposed if they are visiting the hospital. So this means that some members of the population who suffer from comorbidities, even some of hypertension or heart disease situations, they're not seeking the care that they have, or they're taking medication for diabetes. When their medication finishes, they don't replace that right away because they're in the quarantine mode. So really the grand impact that COVID-19 is going to have on these populations and on healthcare systems, we can't only count numbers. We can't only say Mozambique has 234 cases of COVID-19, and that is sort of the impact. In order to understand what is the impact of COVID-19 on the healthcare system, we have to be totaling all of those direct numbers, but then all of those indirect influences as well. And the economic influence, the number of jobs that have been lost or that have temporarily been closed, is really going to have a direct impact on an increase in hunger. And this is a context where hunger is not a feeling, rather hunger is a reason to die. So, the numbers that we should be counting regarding healthcare and the numbers that we should be counting regarding deaths need to be holistic numbers. We cannot only look at COVID-19 and count on the limited number of tests that we're able to really provide to say that, okay, this was the sum of the impact, but instead be totaling these economic numbers, looking at the impact on the economy, on household livelihoods, and also really looking at holistically at the healthcare sector, and not forgetting about these other diseases. If the nets don't get out this year for malaria, the number of people that will die from malaria will directly increase. And I mean, that's kind of an obvious statement. That is what we would expect to see. So it's important that we try to prevent as much as possible these other deaths that can be caused by the COVID-19 measures.
Thank you, Leah. My next question is for Irina. Yeah, I wanted to ask you, like in Madagascar, what has been the government's response towards the frontline health workers, and even in terms of infrastructure, uh, what are the preparations that the government made?
So for the frontline workers, the first move was to provide one-shot financial support to people who are earning their bread daily, like those who are in the transport sector and other sectors. And they also gave some financial support to vulnerable people, and also basic commodities for households. And in terms of infrastructure, the authorities made a center to monitor all the activities regarding COVID-19, and also to treat the patients. So it's a very huge space near the airport, and it's in the capital. So it was since March, and now we have another epidemic center also, which is being built in another region, which is Thomas in the east part of Madagascar. And they adapted some facilities which are already there, and they just came with beds and all the medical stuff and material and the professionals of medicine. Regarding about infrastructure, we had very clear medical protocol at the beginning for the treatment of people at the center. And also they installed the partial lockdown, so we didn't work, or we weren't allowed to go out in the afternoons. And now it begins to relax little by little. We also had a curfew, and we were recommended the physical distance as in other countries. And it was promoted by a very huge media campaign in the social media and even in the streets. And they also installed the hotlines for people who wanted more information or in case of emergency. And the measure I really appreciated the most was the mandatory masks for everyone. And I noticed that it also provided some working opportunities for other people, because those people who are selling, we call it taxi phone in here, and so some of the taxi phone owners uh, went into the mask business, and they are all selling masks at each street corner. So I think it's a good thing, and it also contributes to protect everyone.
Thank you so much. Now I'm going back to Chima. Yeah, Chima, can you hear me? Yeah, Chima, a question for you, my friend. Can you hear me, Chima?
Can you hear me?
Yeah, you are.
Can you hear me?
You are on two windows. Yeah.
Okay, then let me get off one.
Okay.
Bye.
Cool. Good to have you back.
Good.
Chima, you are also a big election expert in your country, right? One of the questions that we received for you was whether it's time for Nigeria and the rest of the Africa to adopt an electronic voting system. Because in the light of COVID-19, you might not have people stepping out. So whether it's the right time to introduce electronic voting through electronic
Yeah,
means.
yes, we have had to deal with the issues of electronic voting system, introduction of electronic voting system even before now. But like Basca, and I'm sure Leah will agree with me, the United States of America, arguably the most advanced democracy in the world, is still trying to get over the issues with this electronic voting system and mailing systems and all that. And we're talking about the United States of America. And if they're still grappling with that challenge 4 years after, then how much more Africa? The Kenyans tried the electronic voting system, and it led to the cancellation of the presidential system, the presidential elections, and because of some of the challenges and issues, complaints of rigging. Look, Nigeria is already 75% electronic in terms of our voting system. Now you have a four-step system in the Nigerian voting system for you to finally press or cast your ballots. You have to deal with accreditation and identification of individual. As we speak right now, the voters register is fully electronic. Before now, our voters register had to be done, you know, manually and yearly. But right now, it's fully electronic, and every Nigerian voter, eligible voter, has a voter's card that is captured electronically. Now, after that first step, the next step is what you call to ensure that whoever is holding that card is the same person contained in the electronic system, the database. It's also electronic, that's accreditation. So you have the electronic system where you bring a smart card, you put your fingerprint, and you capture the electronically. It's also electronic. The only thing that is manual in the Nigerian system is the actual balloting, where you still have to do it, paper and all that. Now, Nigeria ultimately wants to get to electronic voting, ultimately. But even if you vote electronically, how does that prevent COVID? Because you still have to come to the ballots, to the the polling stations. You still have to queue. You still have to complete on whatever device is going to be provided for you to complete, and then that exposes you with the virulent nature of the COVID-19. A mere contact with any machine and another person touching it exposes you. So what we are saying is that whether you're using electronic, whether we are going to use the system that we're currently adopting, that there should be protocols, there should be guidelines on how to ensure that people are safe. And those guidelines have been put in place already. The election management body has introduced, insistence on using the face mask. They've also introduced use of disinfectants and hand sanitizers before the eventual voting, and then the maintenance of, instead of the 6 feet now, they're talking about the maintenance of a 12 feet gap between individuals when you queue. They're also talking about sanitizers for the election workers and all that. Now, these are guidelines that we put in place. Whether they work is a story for another day, because we still don't understand this virus. We still don't understand it. I was reading the other day, we were told that the use of face masks can prevent, can reduce the exposure. But we also see instances where we're told that some of the face masks that are available, that the virus even seeps out of it. It's still a virus that we're trying to understand. However, the onus is on the election management body to ensure that protocols are put in place to reduce the risk. Now, some people have said, why don't you just forget about elections for now? And you can't forget about elections for now, because it puts you in a constitutional crisis. We go by ours is a constitutional democracy that has timelines within which elected officials must go. Now, you can't suspend the election, the constitution. If you suspend the constitution, you are opening up a whole gamut of problems. You understand? And you know what? We're just celebrating 20 years of continuous democracy. You can't suspend the constitution. Therefore, you have to find a way to go around it. And we are happy that countries are beginning to open up. The Americans are opening their economy. The Madagascars have shown us a way to go. The Ghanaians are opening up the economy and all that. So we have to vote eventually. But like I said, whether COVID-19 or no COVID-19, as a developing country, we must be very careful on how we embrace technology in our system. And like I said, the samples are all there. We are not India that's perfected the use of technology. I mean, over 300 million, or how many million are voting in India? Over a period of 1 month, not in a day. Our election is in a day. It just takes a period of 1 month for you to capture the entire voting population. Unlike Nigeria, where this thing must be done in a day, counting done in a day, and probably released the next day. So we have to be very careful and very slow. And like I said, even if you use some form of voting and you have to complete on a box or a machine, it exposes you to the virus. So I think we should stick for now with the process that we have in place, where each individual takes the ballot paper, goes into the box, votes, and walks away.
Thank you, Chima, for your insights. They were really, really good. I want to go back to Leah now for a question. Yeah. Leah, we were talking about the loss of livelihoods and loss of income in Mozambique. In the long run, what do you think will be the socio-economic impact of COVID-19 on the people and on the Mozambique economy? And what, according to you, should be the right policy response? Because the country was already in a bad state, as you mentioned to us. And now with COVID-19, things might go back a notch further. So how do we deal with something like this?
So I would say that, the country like Mozambique, there are a couple of ways that they need to deal with it simultaneously. And I don't think that we can expect Mozambique to, solve themselves. There's been some great international solidarity that has been able to assist Mozambique in really meeting this crisis. The European Union, UNICEF, generous in donating PPP for them to be able to adequately respond, especially for healthcare workers. So I would say that, on one hand, this sort of continued support from the international community is paramount. However, it's a very challenging situation. And, where there is an economic recession, there's an economic downturn across sectors, across industries, across countries. the humanitarian sector has been extremely hard hit in this moment, and it's very challenging because we have a pre-existing humanitarian condition in the country, and now we have the additional COVID-19 economic downturn. So the aid it needs to be able to continue to, gain this international solidarity in any way possible. We've seen some extremely generous donations from various, and I hope that we can continue to see that generosity, that generosity can continue to find revenue sources so that we're not making countries perhaps had pre-existing, limited healthcare systems take on now the economic ramifications alone. We've also seen organizations like the IMF or the World Bank also being really strong partners for Mozambique. So that's good news. However, the issue that we must discuss is the economic issue. This was the point of your question. We've seen reports from the CTA, which is the Confederation Associations of Mozambique, and they've mentioned that there are 26,000 jobs right now just in the extractive industry that are at risk because of COVID. So in Mozambique, the first case that was discovered was essentially in this extractive industry, as I mentioned. And following that, the site in northern Mozambique, which is in the area of Palma, had to significantly decrease the number of staff who are present on site. Now they're down to about 400 people on site. So in the situation of mines, of extractive rigs, etc., these are large groups of people. Essentially all of the employees lived on site. They all lived on camp. And now we're in a situation where, schools have been, it's not safe to have kids together. Universities have been closed. These camps have had to send their workers back home. And the only way that can continue is really on site. So in economies where a large percentage of the population is in the informal sector, it's very difficult them to have the same resilience that we have who can, open our computer and work from home. So this is an extreme they're going to face going forward. I think that what they can do is really try to take small steps to continue to secure their livelihoods, to support education, to not allow this COVID-19 crisis to take every other pre-existing condition back 10 years or so I think that we need to continue to allow farmers to go to their fields. We need to allow transport that can be done so that people who are living in peri-urban areas, are not prohibited from going to their fields, being able to get their crops, their life home to their family. So it's going to be very interesting to sort of watch what happens as some economies now, such as South Africa, are trying to open up or are in a position where they're beginning to consider, okay, we've done quarantine, we've closed down for a couple of months. We can't stay closed down forever. We have to address the livelihoods question. So, at the moment that countries reopen, even countries that have benefited by closing down, we have to continue to observe the good practices. And these practices, some others have mentioned, washing hands, making soap available, hand sanitizer, covering face, using a face mask, having limited number of people in public transportation. But we have to find safe ways so that industries can continue to operate, or we're going to see even larger economic impacts.
Thank you, Leah. Thank you. I now want to go back to Hari Nirina for a question that we got for her. How do you think, with all that's happening in Madagascar, do you see COVID-19 as an opportunity to develop local capability when it comes to clinical trial management? That is one of the questions that came for you.
Okay. So I'm not a scientific researcher, neither a health professional. So I don't really know what is the capability in terms of clinic trials management in Madagascar. But I know that in times like this, it's a big opportunity to get funds into research and development. And it will be good if the funds really goes to research and development, because I know that the researchers in my country are very brilliant, but they lack means like materials and so on. So it's definitely an opportunity to acquire these means, laboratories, and other tools. And for instance, I know that some embassies in here directly support some laboratories and other health institutions, providing with medical commodities and also some free trainings. And I really hope it works, not just for the case of COVID-19, but also for the future and for the improvement of science in Madagascar.
Thank you. Now I want to go back to Chima again for a question. Um, Chima, can you unmute yourself? Yeah.
Good.
Yeah. Chima, one person asked this question that in your country, people are under the belief that there is no coronavirus in the country and they are just going with their day-to-day life. Do you think that kind of an attitude is correct? Or is the government propagating that kind of thinking that no, there is no problem in the country? Let's just go with our life the same way we used to be.
The truth is, like I said earlier in my introductory statement, that there's a sizable population, a significant population that thinks that this whole thing is a scam in Nigeria. And they think it's an attempt for the usual suspect, corruption in government places. And do you blame them? You can't blame them. Look, I will give you a small analogy on why people think this is a scam. You have a country that it took us in the last 20 years, we have not been able to get a national identity card project right. As I speak with you, billions of dollars have been sunk into that project, and not up to 1%, in fact, 0.5% of the Nigerian population has a national identity card. As I speak with you, out of the over 84 million registered voters in Nigeria, about 15 million have not been able to pick up their voters card because of distribution issues of distribution. You have a country where there is a claim that there is a school feeding program, and many of these children that go to school have not been able to access the school feeding program. And then in 1 week, the government says that it has distributed about 20,000, maybe a little under $10 to 70 million Nigerians in 1 week. Come on, any right-thinking person knows that that magic is not possible. If you are not able to distribute national identity cards in 20 years, if you are not able to distribute voters cards in the last 15 years, how were you able to feed 70 million persons within a week? I mean, come on. So, and then there are other instances. For example, you tell us that there are 8,000 cases of COVID-19 in Nigeria, and you tell us you have isolation centers. But we go to the isolation centers, many of these isolation centers are not functional. Most of these isolation centers, even the ones that are functional, there's nobody in there. There are very few persons in there. For example, I just heard that in Lagos State, there are so many vacant beds in isolation centers. So how would you expect a population that is very suspicious about any government agenda to believe that there is actually the present, or maybe, of course, there's a belief that there's something going on, but that there is something being done about it. So it's not so much about there's no coronavirus in Nigeria. No, there's a belief that there's a disease that is killing people. I mean, I think every Nigerian has seen somebody that he or she knows, or somebody who knows somebody that's been pronounced dead because of this virus. But the question is, Nigerians don't believe that the various measures being put in place by government is actually there, but that is meant to address the issue. And so people are going to their normal businesses. In a state like Lagos State, a state that has over 20 million persons in that state, people are going their normal businesses. Nobody cares. People feel the whole concept of quarantining, lockdown, just a scam. It's a ruse. And so let people go. We die, we survive, and then, like we say in Nigeria, everybody to himself and God for us all. However, I really think that it also addresses the larger issues of, policies, the so-called top-down policy, directions in Africa and mostly in Nigeria. When you have a situation where people doubt the intention of government, I don't think the way you have to go about convincing people that you mean well is to use the same systems that has failed all this time. You should use systems that are closer to the people. And the local government, like I said, at the state-based level, the community level, the religious leaders, to talk to them. And Nigeria is also not just one monolithic country, like as you may think. In some parts of the country, there's very serious awareness that something is not right. But everybody believes and everybody agrees that even though something is not right, that the government is not doing enough to address the issues, and that is where the problem is. But then you hear huge sums of money being released. As I speak to you, the Nigerian government has spent over $2 billion on palliatives and incentives to tackle the COVID-19. But very soon, the Nigerian Bureau of Statistics is going to release its records, and you will hear that unemployment will be on the rise. The Central Bank of Nigeria just released statistics to say that the projections for growth, the IMF projection of 3.5% of growth, is not attainable because of COVID-19. And he's saying, look, open up the economy so that we let us know that there's at least a sense of something going on in the economy. Now, how that is going to be approached, because even the measures we put in place, the curfews, the quarantine, nobody is respecting it. Everybody is going on their normal business and as if nothing is happening. So the distrust and mistrust between the populace and the government, it's not so much as the people not giving the government a chance, but because of what the government has done on its own. If you go to if you Google, you will see a state in Nigeria, Kano State, for example, that says it has about 1,000 persons that are with COVID-19, and that these people are in isolation centers. But that isolation center is still under construction. So how do you think people will believe that that there is COVID-19 in that state? So these are the issues that make people doubt. That's just about it.
So we're running a little short of time. There's just one final question that I want to ask each one of you, and you can all answer it separately. So Africa has one of the lowest number of cases compared to the rest of the world, and just 0.1% of the deaths that have been caused due to COVID-19. So I want to know, what is the reason behind that? Is it because there is lack of data, that maybe there are more cases and we don't know about it? Are the deaths being underreported? So I just want each one of you to have a go at this question and give your insights on this. So I'll go first with Leah, then Chima, and then Harimira.
Yes, thank you so much. So I've mentioned or alluded to a couple of the reasons that I think help to explain numbers. In first place, we see a number of countries that have taken coronavirus seriously from the beginning in African countries. So these measures of lockdown quickly, as soon as cases began to appear, has allowed cases to remain relatively low until the present day. However, the condition of when these economies reopen and what will happen then, I think, is a situation that we're going to see the numbers continue to increase, unfortunately, as the year goes on. That being said, there are some, let's say, pros and some cons for the number of cases in Africa. We see, some benefits that Africans have. There's, a young population. There perhaps are numbers of people who are asymptomatic and maybe are having the coronavirus, but not really suffering from the conditions. And in addition, the rural populations clearly are at a little bit of a lower risk. However, there are other populations in Africa that are at extremely high risk. So we see, populations of people who are either refugees or internally displaced, living in camps, large number of people together, very poor sanitation, non-existent soap, and really limited access for some aid organizations to get to them. So they're going to be at a really high risk, and they continue to be at a very high risk until this really gets controlled. We see also the numbers of people living in very large cities or the kind of slum area of these cities as being potential epicenters for community transmission. So I've already mentioned that there is some testing limitations in various countries. I think that they're doing the best job that they can. They're doing some rather commendable work. We've seen very low cost Africa, these sort of African solutions, which I don't think we can discuss what's going on with COVID-19 in Africa without commending the scientists and these African governments to come up with solutions. I mean, a $1 test kit. This is something that that we are not seeing in other European countries. So we do need to commend some of that local innovation. The pool testing for blood samples that we've seen as well. But I would say that I don't tend to be very optimistic about the fact that Africa doesn't have that many cases now. They probably won't ever. Maybe the issue won't be too bad in Africa. I don't tend to follow that line of thought. I think that this is a real crisis, and Africa is not.
Thank you. I think now I'll go to Madagascar first, and then come back to Chima. I think Harinirina has been silent for a while now, so let's hear it out from her first on this question.
About the low rates of COVID-19 in Africa. Lately, I saw a webinar on West Africa, and they raised the fact that Africa is used to dealing with pandemics and with epidemics, sorry. So like Ebola and cholera and malaria. So I think to me, it's one of the reasons why we were able to tame the impact of COVID-19 and to kind of limit the diffusion. And also, I totally agree with Leah when she says that we have a limited testing capacity, because as for my country, I said we were like 25 millions, but to date there are around 10,000 tests, also just 10,000. So it's a very small proportion of the population, and we didn't do it systematically, but just sometimes waiting for symptoms or over hints. So the person would go and ask for a test by himself. And lately, I think it was yesterday or today, I saw a report on the countries in the ocean, the Indian Ocean, and some of them already claimed that they own the battle against the coronavirus, but tell us it is coming back again. So countries like Mauritius, who has had zero new cases for days, and now they have new cases. And as it was also the case in Madagascar, we've had 0 cases for a few days, and now we have like 60 new cases just from yesterday to today, I think, if I'm not wrong. And also the main issue is we have like severe cases, because before we had just like asymptomatic and not so serious cases, but now we have some serious ones, and we also have officially more deaths than at the beginning. So to me, it's not yet we're not yet out of this, and we should really try to make a global or regional effort to make tests possible for everyone and to produce an effective remedy.
Thank you so much. Thank you so much. And now, Chima.
I think it's early days yet to talk about any miracles in Africa. My colleagues have already talked about the limitations, testing and all that. And then you have the integrity of the data in most African countries it's in question. So you really can't talk about something novel happening in Africa. And then, like I said, the disease is something we're still trying to study. Initially, when it started, they said the black man cannot, the blacks are immune from it. Then it talked about whether the hot African weather will neutralize it. Now, we really don't know what's happening. But what I know is that to take a case like South Africa, that you can believe its data because of the sophistication of its healthcare systems and the seriousness with which they have confronted the disease, you would find maybe some answers to the question that so far, with the massive test, and South Africa is one of the few cases in Africa that have taken testing very seriously. But you still have deaths as at yesterday under 1,000. So that tells you that perhaps there is something really going on in Africa. But then other parts of maybe sub-Saharan Africa where people die every day. I mean, the number of people that die from malaria, as whatever is happening with the COVID-19, people die every day from malaria, people die every day from hunger, and we don't have records. We don't have records of what people die. I mean, because of religious sentiments, we don't even conduct what do you call it? You don't do autopsies. So as soon as people die, you bury them, and so when you don't conduct autopsies, how do you know what the cause of death is? And then people, because of stigma, they want stigmatization. People don't want to turn themselves in because nobody wants to be associated. Nobody wants to be known as the man that has COVID-19 in the next door neighbor. So nobody's coming forward. People are taking measures like going to private hospitals, and that's one of the failures of the Nigerian government, for example. The first port of call for any Nigerian is not to go to a government hospital. He goes to a private hospital or he goes to a herbalist. Now, you didn't integrate these systems into your whole COVID-19, interventions. So many people are in private hospitals, they die, they get buried, they get healed, they go home. So you can't really trust the integrity of the data. But what we know is that people are not falling on the streets and dying from COVID-19 yet. And then we know that it's still early days, and very soon we'll be approaching the rainy season. We don't know how the disease would be, the virus will behave in a more colder environment, unlike now that it's still hot. So, but my advice generally for African countries is to take this seriously, test vigorously, and more importantly, begin to look for local solutions. Because right now, until the globe takes care of itself, nobody's going to look at Africa. And the local solutions, no matter how bad they are, you have to look at whether you talk about cheap testing as they do to South Africa, in Senegal, whether it is about even what you call cures for it, or even prevention. You have to look at local solutions. No medicine you use today comes from the heavens. They are derived from herbs, and these herbs we have in abundance. The laboratories, the research institutes must have to be reactivated and given the necessary wherewithal to begin to engage in serious research to find global solutions for whatever we face, not just for COVID-19, whether it is malaria, whether it's Ebola and other diseases that are known to be peculiar to sub-Saharan Africa.
Thank you, Dr. Chima, for your insights and inputs. It was a very wonderful discussion with all of you. I really want to thank all of you for taking out time. We are all in different parts of the world, so it was a bit difficult to organize this discussion. A lot of people joined us today also on our Facebook page and on our Twitter feed. Thank you so much. Thank you to the speakers for giving us their insights from Africa, and I hope that now the world should listen to what it's, the African people are saying and what's happening in Africa, and not just look at the West for all the answers. Maybe we have answers in Africa for COVID-19 and a lot of other diseases that are there that might be coming for us in the future, because we don't know if it's just COVID-19 for now. Thank you so much for joining me in this virtual discussion. It's time to say goodbye. Thank you.
Goodbye, Leah. Goodbye, Eric. See you guys soon.
See you.
Bye.
Thank you very much.